Hello, my name is Min N. I'm a board-certified facial plastic surgeon and the medical director of the Aesthetic Wellness Center located in Westborough, Massachusetts. I'd like to talk to you about my approach to lip rejuvenation and a technique that I've developed that allows me to create natural-looking lips using the filler Juvederm. And I'd also like to address some common misperceptions of lip rejuvenation that many people have. The primary misperception that people have is that if you do anything to your lips using a filler, they will automatically look unnatural. And unfortunately, the reason people feel that way is because they see in popular magazines lips that have been overtreated and overfilled, and those are the most obvious and unattractive looking results. The lips that are done properly are the ones that look very natural, that are proportionate and fit the person's face, and those are the ones that don't look obvious. So in fact, the ones that are performed properly are the ones that are not obviously treated.
Now, if you think of some of the current concepts in facial rejuvenation, one of the most important is achieving that natural appearing result. Recently, I had a one-on-one conversation with the president and CEO of another filler company who told me that he felt that hands down Juvederm is the best filler for lips, and I would agree with him. When you think about what makes a youthful lip attractive, one of the first features you notice is a well-defined vermilion border, which is where the red and the white lip meet. That vermilion border extends to include the Cupid's bow, which is that M arch at the top of the upper lip that tends to flatten over time. Now, if you look very closely at youthful lips, you'll notice a fullness in the central upper lip, which we recreate by placing a small amount of material there. The fullness in the central upper lip fits into a slight depression in the central lower lip, which is also characteristic of a youthful lip. On either side of that cleft, there's a pillow and a pillow, so we place a small amount of Juvederm in each one of those areas to recreate that. Now, what we don't want to do is place material just above the vermilion border, or even directly along the vermilion border to avoid that duck look. We also don't want to place the material directly across the upper and lower lip, so that we can avoid the unnatural look such as these. Now, we do want to place a small amount of the material just below the vermilion border to accentuate that, and then to extend that treatment to include the Cupid's bow to accentuate that M arch. Then we continue on with the treatment to include the other side of the vermilion border. To recreate that central upper lip fullness, we place a small amount of the material there in a V shape. We then extend that treatment to the lower lip vermilion border. And then most importantly, we place a small amount of material on each side of the cleft to recreate the pillows. And you can see here a nice recreation of the Cupid's bow and a creation of the pillows. And then here another creation of the pillows in the lower lip. Here again we see a youthful appearing lip with a nice M arch and pillows. And by adding volume with Juvederm, we've created that M arch and pillows. And though these lips are perhaps less shaped, they do appear quite natural. And here we have a patient who's undergoing a lip treatment as I just described. Her lips have been anesthetized with what we call a submucosal mini block, which makes the procedure comfortable without distorting the lips, so I can see where I need to place the material. And as you can see, I'm placing small amounts of the material in a threading fashion just underneath the skin surface. I'm not placing large amounts of the material at a time, and in that way we can achieve a much more natural appearing lip. It's very important to accentuate that Cupid's bow, which is that M arch in the central part of the upper lip that tends to flatten over time. And as you can see here, we're placing small amounts of the Juvederm just underneath the skin surface to accentuate the cupid's bow, and now the other side of the vermilion border. The threads of material are placed just away from the vermilion border within the red lip, so it doesn't create that ducky type of upper lip look. And here I am creating that central upper lip fullness almost in a small V shape, and I'm placing even smaller amounts of the material in a controlled fashion. Now with the lower lip, it tends to be somewhat larger than the upper lip naturally, and we do like to maintain those proportions when we perform the Juvederm lip filler treatment. Here I'm defining the lower lip vermilion border, and that's followed by creating those all-important pillows that reside on each side of the lower lip cleft, which makes for a very natural appearing lip. I encourage you to visit us at www.awcenter.com, where there's a lot of informative content and a cosmetic surgery blog, and to see us in the latest 2 issues of New Beauty magazine. And that's a brief description of my technique for lip rejuvenation using Juvederm.